Million people around the world suffer from glaucoma, the #1 leading cause for blindness, a disease that doesn't have a cure, and won't be able to see the lighting of the candles, the clarity from those flames. Belkin Vision is an Israeli startup that's offering new hope, though, for people with the disease to again be able to see the light of Hanukkah. Belkin's treatment is unique in that it's based on a technology that takes just seconds. There is no human touch necessary, so no need for burning eye drops or complicated technical surgery. With us now is Daria Lemann Blumenthal, the CEO of Belkin Vision. Thank you, Daria, for being with me. Tell me more about your treatment. How does it work?
So basically in glaucoma, as you mentioned, the disease is incurable, but the main issue is to delay the progression of the disease. So how do you do it? When you diagnose a glaucoma patient, you want to give this patient a treatment that is accessible, that someone can actually use. So as you mentioned, eye drops is the most popular, but the compliance with eye drops is terrible because patients have to take them for years, every day, for the rest of their lives. Now, laser for glaucoma has been in the market for many years. The problem with SLT, the current laser treatment, which has been proven in the recent light trial as more cost effective than eye drops, the problem is that it requires expertise, it involves contact with the eye, and it takes time. So what we've done, we've invented, Professor Michael Belkin is our co-founder and medical director. He invented the DSLT, direct SLT, which means that it automates the laser treatment. So we can actually use the laser in an automated way that doesn't require skill. It's accessible to both ophthalmologists and patients, and they can practically get laser treatment, a very gentle laser therapy, as a real first-line treatment instead of daily eye drops.
Is this available now in Israel? Is it available around the world, this treatment?
So we are now at the clinical trial phase. We are waiting for our pivotal trial results. Hopefully by the end of next year, this will be available. Our first market would be Europe, selected countries in Europe, and in 2023, hopefully also in Israel and the rest of the world gradually.
Daria, I want to ask you, moving forward in general, amid the pandemic, amid the resurgence of COVID, fears of the Omicron variant, the idea as much as possible to reduce physical contact and physical proximity, if it's possible, with doctors and patients. Does that also play a role perhaps in why this treatment may be so important in the future?
Definitely. So two aspects here. First, the doctor sits in front of the patient, but no contact is required. Second, the time the patient has to be in the clinic is minimal. It's a few minutes. So this is another aspect. And hopefully in the near future, we will also be able, so we are able already to treat remotely. It's only a regulatory challenge, but you can definitely treat patients remotely. So the doctor can sit in Tel Aviv and treat patients somewhere else in the world where the patient simply has to go to the device itself. Yeah. So yes, definitely it applies also for COVID time.
And Daria, tens of millions of people around the world have glaucoma. It's as prevalent in Israel as it is anywhere else in the world.
Yes.
What is glaucoma, and is it, are certain kinds of ages or regions more susceptible to it? I mean, pardon my ignorance, but can you kind of just break down what exactly it's doing to the eye?
So basically, glaucoma is a disease of the optic nerve. And as you know, we cannot restore nerves. So what it does is it actually narrows the visual field. So for example, if I put my hands here and I can see them, glaucoma patients gradually lose their visual field, okay? But when the visual field is already here, you cannot restore the vision. You cannot reverse the situation. And that's why the importance first of to diagnose glaucoma as early as possible. And that's why we definitely, and doctors recommend, go for a checkup starting from the age of 40. Okay, so that's first.
Yeah.
Now, as I mentioned, it's not reversible, so you have to treat glaucoma as early as possible in the disease stage. And with our device, we actually allow patients to get access to quality glaucoma care as early as possible in the disease stage because the device is so easy. So any ophthalmologist everywhere can use it.
Okay. Yeah, Daria, we wish you success, of course, with the completion of the clinical trial.